Welcome to AMA with DMK, hosted by Danné and Dr. Lokhande.
Today we're going to cover boot camps. Now, a lot of you people have heard boot camps over the years. In fact, I was driving down Whittier Avenue the other day and I saw a new private gym, small gym, that said boot camp across the top. What do we mean about boot camps? To preface that, I will say that in the United States of America, we haven't done any boot camps for a really long time. I did overseas quite a lot back in the early days, and I'll explain the difference. There is structural classes that you get certification, such as Program 1, paramedical, et cetera. Everybody has to take those before anybody can buy a product or be involved with the DMK family. Beyond basics, that is another class that goes a little bit further. And then there is boot camp. Now, boot camp is where I and Dr. Lokhande go around to various places in the United States. We're actually starting this weekend in New York City. And what we're going to do is, first of all, theory that goes beyond what they have actually learned in the classes. Sometimes a review, because people forget things, and then a theory beyond that. Backstories, how I formulated such and such a product, why I did it at the time. This can stretch back over 30, 40 years. But yeah, then these boot camps will be much more interactive with the students that come in. I'm going to do practical. The modern generation, I don't think anybody's ever seen me do a treatment. And yet I used to make a living doing that many moons ago. Now, the reason for a boot camp is to back up our several account managers that we have covering the United States in every area. These ladies are excellent teachers. They have to follow up. They take orders. They have to help some of the therapists out of difficult situations. They are the first line responders to any problems, and so on. They need the help. They need something that comes from me and Dr. Lokhande, who's headed up our DMK MD division, where they can actually inspire their clients, their therapists that they've already worked with. This personalized and exact training is really what we're doing. And plus, I want to leave something behind when I finally exit stage left, that people do remember. I've been kind of distant for, quite a long time. Yeah, you see me on these videos. I'll walk into a class held at headquarters here, say hello. I'll do about a 15-minute inspirational speech and leave the classroom. I really loved teaching, full stop. And so that's what I want to be remembered for, and this will help that. Dr. Lokhande, how long have we been talking about rolling this out?
2 years now.
About 2 years. Yeah.
And we were making a lot of adjustment in the content of the boot camp, which topics to consider and all that. So we have really refined it very well.
Well, so I've looked at your day 1 and day 2.
Yeah.
You have to go to medical school.
Yeah.
My job, when you get up there and teach, my job will be first of all, I have to look at the students and see the level of comprehension to what Dr. J is saying. Sometimes I'm surprised. Some people pick it up, like Debbie Dixon, with the genome and the notching and all of that stuff. She understood it.
Yeah.
Some do not right at first. It's all logical. But my job is when I see in their eyes that they're not really understanding everything, and this includes scientific terminology, things like that, then I have to kind of analogize it in a way that they'll understand and remember. So it paints a picture in their mind. Now, I was going to ask you this. In your opinion, how does DMK Bootcamp different from our other educational courses? Well, I've said what I think. What do you think?
Here is an opportunity for entire DMK family to expand the thinking, because I always give this example that RRPM model of DMK is not just a theory. That theory has come.
No, it's an actual 4-tiered division: remove, rebuild, protect, maintain.
And it's easier said than done. You know why? Because after you have performed years together of the aesthetic practice, how you have understood the skin's biochemistry, physiology, pathology, then
Histology.
you have derived RRPM, not other way around that, okay, you got the RRPM and now then you started deriving all the protocols and all that. So here the theory is after the practical. And what was that core thinking concept of yours that we need to transmit in the boot camps? And one quick example, I would like to put here that uh, skin or any other human organ is three-dimensional.
That's
We
true.
are the three-dimensional
Yep.
organisms. But unfortunately, our thinking is two-dimensional.
Yeah, and people therapists actually treat it like it's actually a one-dimensional flat surface.
Yeah.
They don't take into account there's hills and valleys and all that
Yes.
other. Yeah,
And
you're right.
just when we do not really have the three-dimensional thinking in order to approach to the skin, then we are missing a lot of things there.
That's
that
true.
How to integrate the protocol, how to integrate the home prescription, what is the logic, and how to give the best sustainable results to the client. So to convert that two-dimensional thinking into the three-dimensional thinking is, if you ask me in a one sentence, the main objective of the bootcamp.
Right. And another thing about the boot camp too, and this is where I love it because I get to talk about things that we haven't developed yet. You know, I was always getting in trouble with Randy Larson, my business partner, and other people up here in the executive floor, because you and I would be working on something, and in the past I have been working on something, and I get all excited and I start talking to the distributors, and this is what we're doing, and I've seen thus and so far, and I'm so excited. And it really is not fair because then everybody wants to know when it's going to come out.
Mm-hmm.
And there's sometimes a long history before we actually get into production and things are in a container to use. Even though we may have samples we're working with, the theory is very good, it's still not wise to do. However, in boot camps we can. You know, it's confidential, anecdotal evidence.
Yes.
Anecdotal, but
That
there's
is important.
nothing wrong with anecdotal, just like placebo effect has a lot more powers than people think.
Yes.
Remember, everything comes from the brain.
Yeah.
Everything. But anyway, we have anecdotal evidence of new discoveries. We can't prove it yet, but we end up usually doing it through clinical trials and then all the testing and so on. And then we also discuss the depth and complexity of the education behind these things and briefly review everything to the attendees of the boot camp. Okay, now, I'm going to ask you these imperative questions. Why is attendance at these boot camps crucial and not optional?
Because boot camps we consider as a part of continued education, and it's not an optional education. So like how we have beyond the basic class, which goes beyond the paramedical training, we incur a lot of other points, a lot of case studies, and what we have gathered, the evidence from our field, and that is a real-time, clinical case studies and all that. So this is a perfect opportunity to learn and enhance our quotient on the understanding of the entire skin.
And so we can tell some of the stories of things that go on here, such as Julie Newmar's basal cell carcinoma, and such as Dr. Steve Mandel's seborrhea keratosis, and some of these other cases that come down the pike. Now, whoever wrote this script is quite smart because they put here, for the first time in decades, and I guess it has been decades, that Danné, me, have stepped in to personally instruct and conduct DMK education. And this is true. Even after we had the boot camp planning, we were planning it out. I think it was the Italians came, our new Italian distributors, and I actually got in on the practical, teaching the practical with them. And I went home that night thinking, wow, I haven't had this feeling for a long, long time. it's like this satisfied feeling that you've really gotten into their mind and inspired them personally.
Yeah.
And so that's one thing I'm so happy about this. And then and also learn firsthand our scientific philosophy from me, how it started, why it started, and so on, some anecdotal backstories. And then the exciting mind, this young man, behind our present day innovation and execution. I'm very fortunate. You know, when Dr. Lokhande walked in, I knew him for a couple of years before he came aboard with DMK. And I didn't like what he was doing. I didn't like the company that he was wasting his genius on. So we brought him in here because I knew that everything that I came up with or even thought about, he would have a medical, anatomical, physiological, histological backup to it and be able to explain it. And I needed that. I'm not a medical doctor. So he came in with all of that works so well. And he has no idea about treatments or applications or products. In fact, I have to tell this, and this doesn't sound too nice, but I just have to tell this. We send him out to various events such as NASM Pro, Denise Fuller's NASM Pro, which is quite a good venue and quite a good presentation. And we of course book a stand and we have a speaker. Used to be me, now it's Dr. Lokhande, sometimes my nephew Drew Coleman goes out, and some of our top AMs. And the first one he went to, now remember, he's totally naive to this business. He came back, he said, yes, the audience seemed to like what I was saying, but Danné, after my speech, I went down on the floor and took a look at a lot of these stands and products, and about 98% of everything, it was total BS.
Yeah.
Now this coming from a naive person. He's not meaning it. He didn't even say it in a mean way. He just like he was shocked. I go, welcome to our industry, Dr. J. I've known that for a long time. That's why I spent 56 years trying to do things that weren't BS, you know. It says here that I'm not a finite resource. Well, I'd like to pretend I was a vampire. I know I don't look my age, and I sometimes feel it, but mostly not. When I feel it, it's early hours in the morning or, you know, some other time at home like that. But I won't be around forever. I may not be lucid. I mean, I might be here, but I might be, you never know. Hey, you don't know, because I've personally known people that were totally sharp and real one day, and the next time I saw them, they had dementia, and you could see the neurons slipping away and then fading away. It's a horrible thing, and that's the only thing that scares me to death, is losing it. And I hope I have the grace to understand when that's happening to me and let him take center stage and I sort of fade in the background. And I won't mind. I've had a wonderful ride. I've had a wonderful life, and I've had a lot of great experiences in this whole journey of discovery and fruition in the aesthetic sciences.
Well, you have a lot of biological age with you, so.
So you say.
Yeah, so I'm really not that worried about that point. Yes, you could be, but I'm not, because I know your biological age, what it is.
Well, and all the stats that came from when I did that 3-day executive scan at the Cleveland Center in Ohio.
Yeah.
That 3 days where they just looked at everything. And they came back with 55 to 60-year-old biochemistry.
Yes.
And so that means that secretly I'm 55 or 65, not 80.
Yeah.
Well, that's encouraging. Who else? Well, Norman Lear is 100, and he's still producing movies.
Yeah.
And I just started producing movies. So who knows?
Yeah.
Okay. Boot camp. You can catch that on camera. Very good. What will we get? Well, we don't have time to go through the whole thing. Certain things like molecular crosstalk of skin functional units. And we'll talk about the keratinocytes and the Langerhans cells, which are T cell components. Then we talk about keratinocytes and the importance of Merkel cells, which is derived from common progenitors of TD and KC. Now, those are acronyms, but you'll learn what they are, okay? Melanocytes, Langerhans cells, activation, cytokines that modulate, all of these things that are going on in the skin during treatment time and after treatment time, we'll cover why and what they really mean. Fibroblast cells, the factory that makes collagen. You've all heard of my little analogy. I've used it for 50 years. Because a lot of people don't understand how a fibroblast cell works like a factory. Imagine them as kind of this big, irregular, with a membrane around the edge, and inside is the factory. And at the front door of the factory, there are 3 workers. And they're amino acids, lysine, proline, and glycine. And on this particular day, the boss of the factory has decided to go on a little fishing trip. So the lady that these collagen fibers are in, she has these, she's actually aging by the minute because the old collagen fibers that are the substructure of the skin are fraying, getting dried, starting to fall, break, weaker. And with no new collagen being made, there is a disease, and I forget the name of it. We had one in South Africa years ago. This poor woman was not making any collagen at all. Have you ever heard of that?
Yeah, no, I don't recollect that name. Yeah,
it was horrible. So she didn't expect any. I've never run into another case. I wished I know I got it down in my notes somewhere. But she was about 30 years older looking than she really was. And we did get some result. She said there was a definite firming and tensor to the skin after several treatments. But anyway, going back to the fibroblast factory. So let's say the boss comes back. He forgot a fishing pole or whatever. And he sees these guys, these amino acids, sleeping on the job. And so he kicks them in the butt. Get up, you guys. Come on. Let's get to work. So they start the conveyor belt, which is a peptide. And they start putting little components together. Becomes tropocollagen, baby collagen. And then out the back door into the matrix as teenage collagen fibers that kind of swim up and then help support the old sagging collagen fibers. That's what we mean by firming the skin. There's a lot of products that say skin firming. They don't say how. This is how skin is firmed. Yeah. Okay, the only way this particular section of skin is firmed. Now, the boss of that factory is ascorbic acid, vitamin C. That's the most important job it has. Vitamin C can do a lot of things. You can look that up in Gray's Anatomy, 35th British edition, under synthesis and cytoplasm of collagen in skin. And it has a big reference to ascorbic acid. It also manufactures elastin. And elastin fibers keep the skin tight, as in when you pinch it like this.
Recoiling.
And it snaps back.
Yeah.
It's like a rubber band.
Yeah.
Now, elastin, I might even get some argument from Dr. Lokhande on this. My logical brain thinks of elastin as a rubber band. Once you break a rubber band, you can't put it back together.
Yes.
I think the same thing with elastin. Collagen, we can pursue manufacturing. I don't think elastin is so certain. I really, really don't. Maybe I can be proved wrong, but that's just how I think. Okay? Sometimes, one of the things that plastic surgeons do, and that's the best thing they do, and we have a lot on our team, is when the elasticity of the skin is so bad that they actually can take away the excess, by undermining tissue and cutting it away and replacing it with sutures and so on. Doesn't give you new skin. They can't do that, but they can take away the excess. And that's where we actually applaud good plastic surgery. And we work with them, because any surgeons that have DMK in their office has no hematoma, hardly any ever. Scar situations are practically non-existent. There's no alopecia from here in this area here, which is very common. particularly on older women when they do the incision. They cut through all of the hair follicles and the capillary loops, everything. And unless circulation is restored to that area right away, hair's not going to grow there. And I'm sure some of you have seen older people like this strange emptiness right there. Well, we can get around that with the treatments at least 2-3 months before. So we talk about that in the boot camp as well, surgical intervention and DMK, and how to talk to a plastic surgeon, how to get one to refer to you. And it's very simple, actually, because you start usually by referring to them.
Yeah.
And even if you send them a patient that goes in for a diagnostic, you have still shown good faith.
Yeah.
And once they see your work, then you have a good relationship and you can build. Yeah. We have a couple of Beverly Hills clinics like that. Sandy Pacheco is one.
Yes.
Where there's a good referral back and forth. And this is aesthetic medicine at its finest.
Yes.
And I've worked towards that for many, many, many years. We talk about the enzyme therapy in depth. Like here, I'll show you another, I don't know how good you can see that on camera. But it talks about the modes that are covered in enzymatic therapy, the biochemical mode, the reticuloendothelial mode, the biophysical and bioelectromagnetic, the blood supply, and the lymphatic system. It was Hexa, or Elizabeth Stenvik of DMK Norway, or DMK Norge, years ago. She was the last student of what was that doctor, Danish doctor, the lymph drainage, Dr. Fodor, wasn't it? Yeah, I think it was Dr. Fodor. Yeah, Dr. Fodor's lymph drainage. Now, this system is very well accepted in hospitals and that in Europe. It's very tedious. Lymph drainage is not sweeping movements or anything. It's very small, tight, boring, and the nurses that actually do it falling asleep. She had to do this, and then when she saw what the enzymes were doing over the lymph nodes, how it was doing the same thing with the pulsing and that, she proved that this was part of reaching homeostasis in the intercellular fluids through our enzymatic treatment. Our enzymes are not just mass that tighten and lift. That's a beauty business description. Lift and tighten. No. There's so much more going on with the enzymatic treatments, and you learn exactly what goes on during all of these different aspects, including the plasmatic effect. And by the way, people, we actually have trademarked that. We own plasmatic effect because another company did try to use it. They had some kind of a peptide mask. I don't know what they had. One of our therapists ordered it, and we looked at it. It was like, no way it could have a plasmatic effect. They just liked the term, so they were using it. So we actually filed for a trademark, and we own plasmatic effect. Wasn't easy to do, by the way, because it is considered a medical term.
Yes.
But we still got it. And there are different types to plasmatic effects. There's the angiogenic type, that's dilated capillaries. There's the proliferative type, that's the striations that you see. There's the osmotic type, that's the fluid-filled bulges that you see. There's the granular type, that's uniform granules. There is the interstitial type, which is the porcelain effect. And then there's the formative type, which is elevated tissue. There's all these various types to one simple effect called the plasmatic effect. Now, why don't you go ahead, Dr. Lokhande, and talk about the contents of day 2?
Yeah, so the day 2 boot camp goes further deep into the integration of the DMK protocols with other therapies like Botox, derma fillers, etc. The most important point here to understand is that how the skin is a true metabolic mirror of what's going on in the body. So what we have done, that we have put like a little quizzes. For example, here, now just by a client walks in and they're complaining about, oh, I have the melasma here, okay? So prima facie, if you look at the lesion, you will see, oh, this is a discoloration issue, something related to the pigmentation. But guess what? If you have not taken a proper history of the client, then you will miss the entire point of diagnosis, because these particular lesions one can get in a alcoholic liver diseases.
Or the what? I'm sorry.
Alcoholic liver diseases, like cirrhosis, like,
Oh.
so
Yeah,
see,
I noticed early days when we would remove the psoriatic plaques, there would be hyperpigmentation left behind.
yes.
Yes, I noticed that.
So the things are not that superficial, or you have to go deeper into that what's going on in the body, and that what you find on the face or the neck, that could be something of a repercussion of that pathology coming. So the point here is that the more deeper you go, the better your diagnosis is, and then you can employ all the DMK therapies in a better way. So you have to create a rationale around it, not just like, okay, I'm doing here and there and all that.
Well,
stuff.
let me expound a little bit on the diagnostic thing. We remember when we first got through with our embioment project,
Yes.
and we sent off a set to Debbie Dixon in
Yeah.
Australia. And we said, now we want you to do a clinical trial on this. This is before we did actual professional clinical trials here.
Yes.
But I just wanted to see, because she's always been very good with observation.
Yeah.
And so about a week later, she sends us 2 photos of a Chinese guy that she had working in their warehouse. And he had these great big, huge melasma-looking hyperpigmentations on his face.
Yeah.
And he was diagnosed by a dermatologist as having hyperpigmentation from eczema. Okay. So I looked at the pictures, and maybe we can put them up, in this podcast. They were there and gone in 24 hours, or less than 24 hours. And I was stunned at first, and I thought, wait. This is not hyperpigmentation per se from eczema.
Yeah.
This is malassezia, which is a skin fungus. And naturally, changing the microbiome of the tissue, which deals with bacteria, funguses, all that sort of thing, got him an instant result. So his treatment series would not involve heavy-duty hyperpigmentation treatments at all.
Yes.
You see, normally they would.
Yeah.
That's why we have to learn how to diagnose. I'm sorry.
And that's why we have remodified our DMK consultation form recently.
Oh my God, it looks like the Rosetta Stone. I mean, it's the most comprehensive diagnostic part. Dr. Lokhande is in the process of kind of slimming it down right now.
Yeah.
Because this is how he thinks, but we are different, therapists are different. So we're slimming it down, still keeping the concept because it's very comprehensive, but he's right about every category on this form.
So the more data we get, the more insights we get from the client, better for us to first diagnose, then treat it, and again, RRPM model comes, and then you get a better mental clarity, what needs to be done, and then you can set your client's expectations in a right way, because sometimes what happens that client has a different expectation, you might deliver more, but then you have to have a proper backup explanation for that what time it is required, how many treatments it requires, how many sets of different home prescriptions have to be employed, what goes in the AM ritual, what goes in a PM ritual. So all that is a very comprehensive approach towards the DMK ecosystem. And very important when it comes to the biological age management of the skin. We primarily consider stem cells, Botox, derma fillers, and some other technique, resurfacing procedures, etc. So how to integrate those? Because we have the fabulous toolbox with us. We have products, and that every product is made for a specific purpose. But when you are integrating the product, what are the principles to follow? What are the do's and the don'ts you have to do? Like you can't be mixing sebum soak with epitoxyl. No, they go one after another. So never ever do that mistake. So all these nitty gritties and all that, what
And
are,
another.
I call it like not treatments, but tweakments. So what are the tweakments will be there in the DMK?
Or do not use the enzyme mask as an occlusive device.
Yes,
Put
very
a lot
good.
of,
Thank you.
Yeah,
Thank you.
We've had therapists dump a lot of stuff on the skin and put the enzyme mask over it. It'll drive it deeper. No, it does not.
So we will be talking about skin biome. We will be talking about the new segments of the skin which have not even perceived by the entire industry, but we are the first one to conceptualize it, and you will see down the year many products will start filling
it. Doesn't start with the epidermis like everybody's taught.
Yes, so there are 7 segments or the layers of the skin which work in tandem. So we will go all this, dive deep in all this concept and all that on day 2. And the most important, this is going to be the interactive session. So we'll be catering actual field case studies, the questions you have, how whenever you get stuck to one point, now you are totally kind of lost or what needs to be done. The client is coming up with a totally messed up skin with other therapies from like microneedling and dermablading and all that, what needs to be done. So we'll be talking on the practical and the theory combined.
And learning.
And learning, yes.
This is very strange for me to say. I mean, I've been considered for a long time as the guy that knows everything. No, I don't know everything. I'll be gone before I even learn of 1/3 of everything. Come on. I'll never forget in Ukraine, Dr. Andrei Sotnik, God rest his soul, my young dermatologist who was so brutally assassinated 3 years ago. God, I think about Andre every day. Anyway, I was there teaching one time, and he came to me and he goes, Danné, how do we treat Demodex? And I looked at him, and I never heard of it. I'm not a veterinarian. I never heard of it. And I said, well, I don't know. We don't have a protocol, but I'll tell you what, Andre, I'll go back to the USA, I'll research it, and I'll get you a protocol. And that's one thing I learned about these brilliant people in Ukraine, also in Russia. They all had university educations given free by the Soviet Union days. So they were like brilliant children with no tools in their hands.
Yeah.
And I'm the guy bringing tools.
Yeah.
So they thought I had to tell them the truth. And if I didn't know something, I couldn't be like a typical American snake oil. So, oh, yeah, we can get rid of that, Just use this product.
Yeah.
So I went home and I looked and looked. I couldn't find any reference to Demodex until I found an old veterinarian catalog manual. And it did have crossover to human, and Demodex follicularum was on it. And it was a tiny, tiny little microscopic mite that actually proliferated and put pressure on the capillaries, which swelled up and become red. And the skin started breaking down. And then if there was any virus hanging around, they'd see the inflammation and we can go to that party. And bacteria too. They all like to dance together.
Yeah.
And guess what? This was the cause, and I can tell you now, of rosacea.
Yeah.
The cause. For years, I've listened to people stand up at exhibitions and classes, estheticians. There's no cure for rosacea. All we can do is calm. That was the consensus. Now backed up by University of Padua in Italy and other places, yes, the Demodex follicularum that anybody can get, and the worst kind is in the eyes.
Yeah.
That we can't treat.
Yes.
But the skin, we can get rid of it, and we can kill off those mites.
Yes.
And then the job of the esthetician is over a period of time, bring the skin back to homeostasis and health.
Yeah.
All of the wreckage that those little suckers have done in the skin, now they're gone.
Yeah.
Now we just get the healing mode, the homeostasis back, and then the skin looks like they never had anything at all. And I've known people, Dr. Lokhande, that have suffered from rosacea for years, years at a time.
And what a social taboo. I mean,
Yeah.
People walking with that red rash all the time, and especially on
Oh, the
nose
rhinophyma.
and
Oh my God.
and
That's the extreme case.
yeah. And the most important that stem line, how the epidermal adult stem cell with our newly launched protocol Stemzyme, how it becomes foundational to all the DMK treatments and the therapies we are doing. So fabulous stuff. It will be a party, scientific party.
Yeah, to you
So,
maybe. To drag this 80-year-old body across the United States.
So
One more time.
I look forward to it, and I definitely excited to interact with more with the field. It's a different dynamics when you are talking to the all across the DMK therapies, what wonderful things they're doing in day
Well,
in
you
and
know
day
what
out.
I'd like to do, and I would like to include you in on it, is go public. Years ago, DMK Australia did a tour for me. It was called 5 Cities in 5 Days. We have video of this. It was
Okay.
like a rock star. Each venue was in like Brisbane, Melbourne, Opera House, Sydney, a big, huge club, Brisbane, a $38 million nightclub with robots and lights and everything. And they had all the DMK therapists in their uniforms out front, champagne. I arrived by limousine. It was like a huge event. And yeah, everybody just signed in, gift bags were given out. And they had the logo projected on laser everywhere. And then I had to get up and be entertaining to these people. And they were people from the public.
Yeah.
Each of the top clinics in those cities was to invite 3 or 4 people who had not had DMK treatments.
Interesting.
And we offered some kind of perk for them to do that. And we had to give them something. I forget. Daniel is a brilliant innovator of events.
Yeah.
And it was huge. The phones were ringing off the wall for weeks and weeks and weeks all over Australia, clinics after that. And I think we should do something like that. Go public. Let the public see.
Yes, and the deepest point what I see here that every DMK therapist here has an opportunity to touch your client's life in the deepest sense through the skin.
Of course.
It's not just treating the skin, but
No.
you are actually treating their life at so many different aspects.
Well, that's why we say confident from outside in.
Yes.
Because some people, old people, are very lonely. Sometimes they're never touched.
Yes.
I've had many, when I was in private practice, I had many patients come in just to be touched by somebody.
Yes.
Never mind the results. Of course, when the results happened too, that gave them more confidence, and then they would start going out more and so on. People that had terrible skin anomalies, thought that no guy's ever going to look at me, get married. In fact, we have one of those cases in Australia. The girl had the worst case of acne vulgaris, and this is in our before and after book. Worst case anybody's ever seen. Almost as bad as mine back in the 50s when I was a teenager. I was a pizza face for sure. And she really had no life. And she was so depressed when she came for treatments. And then about, I would say, 6 to 7 months later, gone, and even the cuneiform scars were leveled out. And she did get married, and guess what? Today, she's still beautiful, and she owns a bridal business where she helps brides and other people look good for that.
See, this is like an alchemy in one's life.
Alchemy, yes.
Yeah, you transform them, and that's the satisfaction what you get. Yeah, you get money, that's the byproduct, but this gives you the ultimate, that contentment, the satisfaction, and you really feel that you are serving to yours and others' life in a fullest way.
It's true. As you well know, everybody that's around me knows, I have no concept of money.
Yeah.
None. If it wasn't for my business partner, Randy Larson, I would be a ship in full sail, probably broke, because I know I'm worth a lot of money now, but I don't relate to it.
Yeah,
It's just
and
there.
money follows.
It just follows, yeah.
So this is the guarantee that day 1 and day 2 boot camp, if you follow it, if you comprehended it, you practice it, you will prosper. I'm saying you will prosper.
So if you are a DMK therapist out in the field and We have a schedule. I know the one after this is Chicago,
Yes, Chicago, and then back in home in LA.
Los Angeles. And guess what? The one in Los Angeles is going to be pivotal because it's at the Newport something theater in Newport Beach, California. And it's 5 blocks from my very first clinic, the one that's in the movie Maybelline Prince, 5 blocks away. So we're going to have Seth Harden, our director, actually film that when we do the videotaping of that boot camp, segue, walk down the 4 blocks up to the theater and so on. It's going to be fantastic.
Yeah, it's a real-time movie and it's in the theater. The venue is the theater.
I know. I used to go there all the time back in the 60s.
So, wonderful things, and of course, this will be the constantly evolving process of boot camp. We will be changing as we see more and more what are the queries coming from the field, what are the real life problems are there, how we can solve it very creatively and sustainably. So that's the entire objective.
And probably one of the best things in my experience over all these years is the inspirational part.
Yes.
For example, this Christmas, no, not this Christmas. Wake up, Danné. It was for my other half's birthday. And his people are in Texas, Lubbock, Texas. And so I flew him down there to get together with his family and have a birthday party. And I didn't realize that there was a DMK therapist in Lubbock, Texas.
Oh, okay.
Yeah, I had no idea. Somehow, Drew's sister knew her. So I said, well, invite her to the family deal. So this little therapist came. She was so excited. She says, oh, I'm definitely going to take the paramedical course now, and I'm going to do this, and I want to come to World of Confidence. It gave her this shot in the arm for me to sit down and talk to her for 1/2 hour. And so, having covered the boot camp, day 1, day 2, it might even end up to be day 3 and day 4. I've actually done some overseas in Europe years and years ago that were 5 days. Of course, that people's jobs and things kind of deter that, but we'll see how it goes. If you would like to attend a boot camp in your city, then talk to your local DMK account manager, and she will pass it along to us, and we'll see how we can put the program together and how people can be attracted to attend, and all of the costs, the venue, the time, all of that can be put on the schedule. Is this safe to perform on this fitness level in the summer? Yes, of course. Actually, fitness level has nothing to do with it. Fitness level is kind of antiquated. I mean, we still mention it and use it, but mostly it's for SPF. That's how it originally was created. And based on that, for instance, like if you're from Norway and you've got that almost porcelain white skin. So the Fitzpatrick test would be, how long could you lay out in the sun without any sunscreen at all before you'd burn? So let's say in this case, 15 to 20 minutes, maybe 30 minutes. Okay, so you go 30 times 30 SPF, 900 minutes, you would be ostensibly protected from damage from the sun. That's what FITS really means. Then it goes all the way down to black people and so on and so forth. Many races are predisposed to solar damage to a certain degree. However, that's not true anymore. With the ozone layer depleting and the solar damage is coming through, even people with the deeper pigmentation defense mechanisms aren't protected like they used to be. So all of that has nothing to do with this treatment. Obviously, this beautiful result, which I think is gorgeous, she'll want to protect, obviously, with sunscreen and so on. And I wouldn't run out laying spread eagle at 12 noon on the beach. I would let it, go for 2, 3, 4 weeks till the homeostasis is locked in, and then she can go around in the sunlight with the screen on. But yeah, it's perfectly safe. Skin by Matthew. Is this the Matthew that I used to know in West Hollywood? I don't know. It could be other Matthews. Is the plasmatic effect actually capillaries or just where the mask cracks where it dries? Okay, I can understand what you mean by that. Once the so-called mask, I assume you're talking about mask one, is dry, that's it. Okay, the 45-minute activity is gone. It's dead. All it is just leftover mask with whatever effluvia is caught up inside. There's no real activity going on at that point. So there's no pressure on capillaries or anything. So it has nothing to do with that whatsoever. All right? Oh, personal question. Is this from Dorothy Ray 3, this personal question? Do you have fillers? Or I'm gonna Shame. Yeah, I've had fillers for years. Right in here, especially. When fillers first came out, I was the first male model for Restylane in Sweden. I have pictures of this. It was a Dr. Ralph Lundgren who did my lips. And in those days, they didn't know that much about injections with fillers. So he gave me a dental block first.
Okay.
Yeah, full dental block. And then he started freebasing the filler into my, oh my God, I screamed. There's a picture of Meta, who was our DMK distributor at the time. She's standing, looking at me, laying there getting this done, and she's going, poor Danné. And I look like Homer Simpson. It was all like this. And then he turned to the audience. They're all standing around. He says, now we do the lower. I says, and now we're not doing the lower. And I actually came back to the United States. And of course, since then, they learned the art of fillers to inject, withdraw, and dispense, and so on and so forth. So I had a few of those done because I really didn't like my lip line at that time. One thing I noticed about lip fillers, if you have them a few times, repeated times over the years, they kind of stay better. They stay that way. You don't have to keep putting more and more and more in. But yeah, back in the early days, I usually try everything that comes down the pike. I had the threads one time. The Aptos company in Russia offered me a free job if I did a videotape showing me getting the threads. And it was Dr. Zachariah in Australia that actually did them. And then he did some at our Beverly Hills clinic. He came over and did it in my neck. So I had about 12, and I felt, and this is documented in articles, I wrote about it later, I felt like a meat puppet. You know, every time I could feel it. Every damn one of those retracted, every one. And I had to have them removed as much as they could. Then when I had a big tumor operation years later, I had a huge globus tumor the size of a hen egg right on the carotid arteries, so I had to have it removed. It was benign. They found, the surgeon said, we found a really funny little suture all balled up with a granuloma around it. I said, do you think that caused the tumor? He goes, no, I don't think so. Who knows? But I do know one thing, it's a stupid procedure. Every one of them retracted. And of course, the excuse, well, if it does, it's benign. It doesn't matter. You can take them out or leave them there. This is blind and stupid. You know, so we called, I think back in those days, it was called a feather lift. And very few top surgeons do that anymore. Not really. It's a stupid procedure, you know, quick fix. Yes, I did have, back when I was, I think, 48 or 49, my chin looked like my mom's. You can see old pictures of me in the 70s and 80s where I look younger, but I had this here. So I did have the liposuction there. And I had to wear this, what I call Gloria Swanson headband for 2 weeks to form adhesions so the skin would be nice and tight like that. And let's see what else. Oh, I did have a little bit of a, and this has to do with Botox. When Botox first came into this country, I was bootlegging it in from our people in Russia. I had the Russian Botox because Allergan was certified by the FDA for medical use, but not cosmetic yet. And yet everybody was doing it. But I wasn't going to get my surgeons in trouble no matter what. So I got them the Botox from Russia, and it was actually better than Allergan's. In fact, both Russia and United States scientists who created it, it was for military use a long time ago.
Oh, yeah.
But that's another story. That's another story. So anyway, after the Soviet thing was over, then here's all these Russian scientists with all these innovations, and they know what to do with them. They want to make money, so they went to the cosmetic world, and so on. So I had Botox done to keep this upper bleph elevated, so I wouldn't have to have, because I'm a little bit nervous about blepharoplasty. Blepharoplasty is okay for people that have really sagging upper, or huge bags. But for normal, it has to be so conservative that it's just scary to me. So I refuse to have it. Now maybe someday, I don't know. But I always manage to keep it up with the particular, because remember, Botox doesn't paralyze anything. All it does is it interrupts the synapse from the ganglia in the brain to the muscle, and that muscle goes to sleep for a period of time. So the other muscles, the peripheral muscles that are not injected, say, oh, well, we have to work harder. So you actually get lift if you're a clever injector. Now, I remember back in the old days, the doctors doing Botox, they would just staple gun. And people would walk around with double brows and all kinds of weird things. It's so funny. But it has to follow the exact muscle anatomy, and it also depends how many units and so on. There's a lot of little variables to Botox. And thank God I know what to look for when I have it done. But I thought, I'm tired of Botox. So I said to my then partner, we had a clinic in Beverly Hills. He had the operating room medical center. Dr. Lawrence Birnbaum, retired, good friend of mine. And so he's talking about a hairline frontalis lift. Okay, it's a little incision right behind the hairline, and there's minimal undermining, and then going up and suturing. So I said, okay, I'll have that, So that I did have. There's a horrible end to that story, though. Well, I would never do it again. That's so crazy. It did work. I looked pretty good, but then it had a ridgy scar, like Mickey Mouse ear type scars, little ridges. I had to fluff my hair to cover it. And he says, well, I can do a better scar revision, Danné. He says, come on in on the weekend, and I'll do it at the clinic. So I went down there on a Sunday. He had this black intern guy, young guy, is still in medical school, as assistant. And he injected me with a local. He says, I'm not going to give you a full anesthesia. He injected me with a local. Forgot completely that when you inject local in scar tissue, it doesn't last very long.
Yeah.
So he's halfway through making incisions to revise this scar. It wears off. And I start screaming. And the poor guy, the intern, he held my hand. He says, you're going to make it, man. You're going to make it. And he says, I can't stop now. I can't. So I had to lay there and finish the incision and the suturing without any anesthesia. It was unbelievable. So that put me off anything else. So that answers your question. Yes, I am on human growth hormone. I have been for, I think, 3 or 4 years.
4 years.
4 years, yeah. I advocate it. There's a lot of bad stories about it that aren't necessarily true. I am monitored, of course, but it does work. I can tell you that now. I've been on also HRT, hormone replacement, because I still like to do stuff.
Yeah, and you should.
And spray starch doesn't work. No, just kidding. I'm exploring new things in that arena too. They've got all kinds of injections now. But yes, I am on HRT and HGH. Now let's turn this next one, Laura Beauty Loft, over to you, Dr. Lokhande, on the rosacea.
Yeah, so that looks like it's a rosacea, and it's a type 1. It's a grade 1 rosacea. I don't know what you have done so far on this client, but you can definitely, if you are a DMK MD account or paramedical, you can definitely do alkaline wash. Make sure that after alkaline wash, you are giving at least 2 or 3 weeks of environment therapy. And do not forget to prescribe EFAs, massive dose. Massive means 4 caps in morning, 4 caps in the evening, because EFAs bring down the inflammation in the skin. Yeah.
And then we've got Mividescan. What DMK products helps hyperpigment? I'm going to let you answer that. But our classic approach, and then what's coming up.
Yeah. So Mividescan, we definitely. We have nice products or the protocols to take care of the hyperpigmentation. Now, again, when you are treating hyperpigmentation, be sure what is causing it, because pigmentation just cannot come as of its own. There has to be a root cause to it.
Inflammatory or passive?
Passive, and take the history again, that if they have done any kind of microneedling or something like that, because that can give the hyperpigmentation in the liquid state.
Hyperpigmentation is defense mechanisms of skin.
Yes, simple as that. Or evaluate about the skin infections of anybody. We have few products. Melanotic drops are there, melanotic cream is there.
Super
but
bright.
If you see that it is a post-inflammatory in this thing, we have beta gel, we have betagen cream. So it's not a standard approach for the hyperpigmentation. And now what we are coming up with a new protocol in DMK, is Chromzyme, which is like really a comprehensive approach to the hyperpigmentation.
Totally different look.
Totally different.
And very fast.
Very fast, because we are targeting, as you know, that skin renewal cycle is 28 days. In some 25, it could be 31, but 28 days as a standard. And our target is that to treat all kinds of pigmentation disorder in that one skin cycle, renewal cycle, because keratinocyte takes up the melanin, and that's how your skin gets pigmentation. Now, once this keratinocytes turnover is completed, the new keratinocytes are coming up, that you can significantly do something, that they are not uptaking the more than required melanin, which is floating in the epidermis, and that's where all the interventions are there. And we are starting right from the melanosome generation to the melanin autophagy in the keratinocyte. So you can see the length at which we are going in the Chromzyme. So first diagnose it, see what's the cause of it, and then take the proper protocol.
And one more thing for you, going on the same subject, hyperpigmentation. Does Stemzyme work for, now get ready, hypo and hyperpigmentation? I have both. This is from Hey Girl EV18. Let me make a note here. She might have a trina versae or melasthesia that's creating the hypo. She might.
Yes. Yeah. And we have given the new terms now. As she has, this is excellent, I like this. Hypo and hyper in the same client, we call it anisopigmentation.
Yeah.
That the new term we have given, anisopigmentation, dyspigmentation, oligopigmentation, cryptopigmentation. So you are of the anisopigmentation type, and definitely Stemzyme would work, and I tell you why. Because when you are generating the new cells in the epidermis, new stem cells, now they can differentiate into either vertical or the transverse. And when they differentiate transversely, they are forming a new melanocyte which will have nice homogeneous pigmentation. So definitely, and we have seen our clinical trial, and from the
everything comes out nice and
everything
even.
Comes out nice, and the first effect what you see in the Stemzyme is a nice homogeneous pigmentation.
And that was what surprised me, because when we were working, and it took us 6-7 years to complete the Stemzyme project, and untold amounts of money. I wasn't thinking about any specific hyperpigmentation. Mm-hmm. I was focusing on the age management aspects and things like that. And it was Julie Newmar with her melasmas that she had up in her forehead,
Yeah.
that suddenly she noticed they were gone
Yeah.
after she had hers.
Yeah.
And she thought it was because I was having her drink lemon juice every morning with the Vitalzyme X internal enzyme that I was prescribing for her. She thought that was, I said, no, it's from Stemzyme. And
Yeah.
then there's the woman in Beverly Hills that you actually
Yeah.
went to Sandy Pacheco's clinic. You did an older actress. She was
Yeah.
quite beautiful, but older.
Yeah.
And she had this huge race, almost like a lentigo
Yes.
in her
Huge
hairline.
lentigo, like 2 inch.
Yeah.
Yeah.
And you did the Stemzyme. The next day it came off.
Yeah.
Just
Just
came off.
like, you know.
Yeah, so yes, it will no doubt alleviate both your hypo and hyper. Last one, Christy Meadows. This sounds like a dancer. And here she is, boys, Christy Meadows. Da 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 da. No, sorry, Christy. I'm sure you're absolutely stunning. When is Denzyme coming to Australia? Well, I'm glad you brought that up because I leave August for Australia.
Yeah.
We are launching it then. Dr. J will be there via Zoom on the spot, which means you have to be here at 8 o'clock at night or something horrible like that. But we're launching it in Australia and in New Zealand. Now, to give credit to Debbie and Daniel Dixon of DMK Australia, she has already done all the manual work, all the protocols, all the explanations.
Ready.
Everything is ready to go. It's just the physical product itself, and then our, professional and our launch.
Yeah.
Just remember, always, knowledge is power. Thank you.